A very warm good afternoon to one and all. Myself, Dr. Anjana from AVPRF Specialty Clinic. Today, we'll be discussing on the Ayurvedic management of IBS. Before moving on to the Ayurvedic management of IBS, first we need to understand about the disease IBS. What are its conventional management practices? And then we will move on to the Ayurvedic management of IBS. So, first we have to understand about the disease IBS. In the current scenario, the changing lifestyle, our changing food patterns, as well as our changing food timings, along with the stress, has contributed to the emergence of numerous diseases. The first system to get involved in these conditions is our digestive system. And in these digestive and malabsorption disorders, IBS is the most common. So, first we need to understand about the disease IBS. Is it a structural or functional disease? Moving on to the disease IBS. It is a chronic, debilitating, functional gastrointestinal disorder, which is very common in the present era. From this statement itself, it is very clear that IBS is a functional gastrointestinal disorder. That is, the functioning of the GIT is affected. That there is no underlying structural abnormality. Now, we have to understand the prevalence of this particular disease. What is the current prevalence of this particular disease shows its importance and management. The global prevalence of IBS is about 11%. This disease mostly affects women than men. The prevalence of IBS varies from 4% to 20% in different Asian nations. Now, this situation is not different in India. In a study conducted by the All India Institute of Medical Science, New Delhi, it was found that out of the 230 cases of chronic diarrhea, 60 were diagnosed with IBS. So, this prevalence rate just indicates that it is one of the emerging diseases. Now we have to understand about the disease IBS. What are its causes? What is the pathology that is happening? The clinical features as well as its treatment. Now, what is IBS? Irritable bowel syndrome is a functional gastrointestinal disorder characterized by chronic abdominal pain and altered bowel habits in the absence of any organic cause. From this definition itself, as I told, it is very clear that it is a functional gastrointestinal disorder. That is, the normal functioning of a GIT is hampered. Moreover, we can find two cardinal symptoms of IBS mentioned in the statement. One is that the patient will suffer from chronic abdominal pain. And the second one is that you will have an altered bowel habit. So the patient will have a chronic abdominal pain and his or her bowel habits will be altered. These are the two cardinal symptoms that can be found in IBS. Based on this alteration in bowel habits, we have three kinds of IBS. They are IBS-C, IBS-D, IBS-M. IBS-C is constipation predominant, IBS-D is diarrhea predominant, and IBS-M is both constipation and diarrhea predominant. So in these patients, those patients with IBS-C will complain more of constipation. In D, they complain of diarrhea, and in M, they complain of both constipation and diarrhea in an alternating manner. Now, before going into the causes, symptoms, management of this disease, we should first understand how this disease IBS is actually affecting our quality of life. That is very important to understand that. So the impact on the quality of life is as follows. Physical symptoms of IBS, as I told, the patient will have a chronic abdominal pain along with an altered bowel habits. So these symptoms are actually distressing and disruptive, leading to decreased physical comfort and functioning. That is, the patient always will have a that comfort, he will not get that comfort. That comfort is actually affected, that his comfort zone is actually affected. The symptoms are usually distressing and disruptive, leading to a decreased physical comfort and functioning. And this decreased comfort will in turn affect his working performance as well as his productivity. So his professional life is also in turn getting affected. Now, these patients usually avoid social gatherings, travel, etc., long distance travel, etc., mainly because of the fear of this flaring up of symptoms. This in turn can lead to a feeling of isolation and withdrawal from social activities. So, their mental factors are also getting affected here. Next is the emotional well being. We can see that most of the IBS patients complaints of anxiety, depression, mood disturbances, stress, etc. These factors are not only one of the causes of IBS, but these factors in turn can exacerbate the symptoms also. So the emotional well-being of the patient is also greatly affected in this disease. Next is the sleep disturbances. As I told, these distressing and disruptive symptoms will definitely affect their sleeping patterns, as a result of which there will be fatigue and daytime drowsiness, which in turn affects their working productivity. Lastly, the healthcare utilization and cost. Because of the frequent healthcare visit, diagnostic test, and medications, the patient will have an increased healthcare utilization as well as an increase in financial burden also. Thus, this disease is affecting our quality of life in a number of ways. Now, we will go into the causes, pathogenesis, and the conventional management of this particular disease. Actually, the cause of IBS is yet unknown, but still, we can categorize it into the following categories. Either the cause can be multifactorial. It may be a GIT infection, the motor and sensory dysfunction is another cause, psychological factors are another cause, abnormal GI motility, and visceral hypersensitivity. Multifactorial in the sense any change in your physical as well as your environmental factors. GI infections. Whenever you have a GI infection, there is actually a change in your gut microbiota, which in turn will stimulate your immune system, and as a result of which, you will have symptoms of IBS. And this immune system will again cause disturbances in your motor and sensory functions. That is yet another cause of IBS. Then we have already discussed about the importance of psychological factors in IBS. Stress, anxiety, depression, etc., are actually contributing to this disease. Abnormal GI motility. Actually, this factor will help in the classification of IBS. When your GI motility is more, it is diarrhea predominant, and when it is less, it is constipation predominant. Lastly, your visceral hypersensitivity. So, though the cause of IBS is unknown, we may categorize it into these following categories. Now, what is the underlying pathogenesis that is happening in this disease? Here, our gut usually have some microbes which are actually beneficial for us as well as our system. So what happens in IBS is that there's a condition called dysbiosis happens. That is, there is a change in your normal gut microbiota. So as a result of this change, what happens is that it will actually stimulate your immune system. We know whenever there's a foreign thing is happening or a change is happening in your body, immediately the body will stimulate your immune system to create a response. Likewise, whenever there's a change in your gut microbiota, what happens is that it will stimulate your immune system or it activates your immune system. And as a result of which, there is a low grade inflammation of the gut. A small or sort of inflammation occurs in your gut, which in turn disrupts your gut brain axis. This is very important in the pathology of IBS. This gut brain axis is very important and thus finally results in the manifestation of the symptoms. So what happens is that there's a change in your gut microbiota. This change will stimulate your immune system. There is a low grade inflammation that is happening, and this will definitely disrupt your gut brain axis, and the symptoms of IBS get manifested. This is a gist of the underlying pathology. Now we have to find what is the dysbiotic findings that we can find in IBS. As I told you, we'll have a decrease in the number of beneficial bacteria and an increase in the number of harmful bacteria, which hampers your digestive system. So in IBS, what happens is that there is a reduced microbial diversity. Your microbial diversity gets reduced, and there are also presence of pathogenic species of bacteria like Streptococcus, Clostridia, etc. Moreover, there is a decrease in the amount of beneficial bacteria like bifidobacterium. So whenever you are taking all these antibiotics and all, what happens is that there is an alteration in your gut microbiota, which further stimulates, which further leads to the manifestation of symptoms of IBS. So in a short, we can say that the dysbiotic findings in IBS is nothing but there is a decrease in the beneficial bacteria and an increase in the non-beneficial or harmful bacteria, which in turn hampers your digestive system. Now, what are the clinical features that can be found in IBS? As I told you, there are the two cardinal features of IBS we have already seen. There, one is the chronic abdominal pain, other is the alteration in bowel habits. The last one is the gas and flatulence. That is, the patient will usually have a distended abdomen and they will complain of gas issues, gas trouble issues. So one is that you have a chronic abdominal pain. Other is you will have an altered bowel habit, either constipated or diarrhea, or it can be mixed. And the last one is that you will have gas and flatulence. These are the cardinal features. Beyond these cardinal features, we have some extra intestinal symptoms which can be found in IBS. These include chronic pelvic pain. You may have a very chronic pelvic pain over your pelvic region. Dysmenorrhea. Dysmenorrhea is nothing but your usual menstrual cramps. Dyspareunia, that is a painful sexual intercourse. Impotence. Increased urinary frequency. Nocturia. Fibromyalgia, that is nothing but dull aches and pains everywhere in your body. Peptic ulcer. An unpleasant taste in your mouth, and low backache. These may be some of the extra intestinal symptoms that can be found in IBS patients. Chronic pelvic pain, dysmenorrhea, dyspareunia, impotence, urinary frequency increased, nocturia, fibromyalgia, peptic ulcer, unpleasant taste in mouth, and low backache. Now we have discussed about the clinical features, the extra intestinal symptoms. Now we have to see what are the alarming factors, or when does this condition becomes a medical emergency. That also we have to understand. First condition is that new onset of symptoms in patients above 50 years. Next is anemia, when the patient is highly anemic. Unexplained weight loss, whenever the patient has an unexplained weight loss. Whenever there's a bleeding, which in turn can decrease your blood values. Fever, acute onset, a continuous diarrhea, continuous pain, a family history of colon carcinoma, inflammatory bowel disease, and celiac sprue. These are some of the conditions where this condition of IBS becomes a medical emergency. When you have a new onset of symptoms, when you have a rectal bleeding, when your HB values are less, whenever there is fever, whenever there is chronic continuous diarrhea, whenever there is a continuous pain, and whenever there is a history of carcinoma. In such case, it becomes a medical emergency. Now we have to just, we'll go into what all diagnostic tests are conducted in this particular condition. We have to know about that also. This particular case is diagnosed as follows. First of all, we have to take a detailed medical history of the patient. That is, we have to properly record the signs, symptoms, your exacerbating factors, the particular food that exacerbate these symptoms, all these should be properly recorded. Next one is the physical examination. As we have already seen, the patient usually complains of a distended abdomen as well as gas and flatulence are also there. So we have to rule out such conditions. The proper abdominal examination should be done in this condition. That is, whether you have an abdominal tenderness, whether there is an overgrowth, whether there is a nodule, all these things should be ruled out. So proper physical examination should be conducted. And the third one is the diagnostic criteria. In IBS, we have a special diagnostic criteria called as Rome's criteria. And this criteria is as follows. Recurrent abdominal pain or discomfort at least 3 days a month in the past 3 months associated with 2 or more of the following. Improvement with defecation, onset associated with a change in frequency of stool, onset associated with a change in the appearance of stool. So Rome's criteria is specifically indicated for IBS, and the criteria is as follows. You will have a recurrent abdominal pain or discomfort for at least 3 days in a month for a past 3 months, along with 2 or more of these associated conditions. Now, just like diagnosing, it is important to exclude other conditions also. as we see, there are conditions which are similar to IBS. Other conditions are there which are similar to IBS, like celiac sprue, malabsorption syndromes, IBD, etc. So it is very important to exclude these conditions before arriving into a final diagnosis. And the next one is laboratory test. What all tests we have to be that has to be done in a laboratory? See, in this case, we already know there is diarrhea. So stool examination is very important in order to rule out infections as well as malabsorption states. Moreover, I have already told the patient may have low HP values. So your HP levels, your blood routine is also important. In the pathogenesis of IBS, we have already found that there's an inflammation of the gut. So your inflammatory markers should also be taken into account. So these are some of the laboratory tests that we commonly do. Now, similar to the laboratory test, imaging techniques are also very important. And your imaging techniques include colonoscopy, sigmoidoscopy, and so on. Now, lastly, psychological assessment. We already know that psychological factors have very great impact in the manifestation of this particular disease. So, psychological assessment is also one among your diagnostic criteria. So first of all, you should have a proper proper history taking. That is, properly the case should be recorded. Then properly physical examination should be done. Then you have the Rome's criteria. Then you should exclude all other conditions similar to IBS. You have to go for your laboratory examination, imaging techniques, and lastly, psychological assessment, which is very important in a condition like IBS. Now, we'll discuss about the conventional management of IBS. How is IBS managed conventionally? Conventional management of IBS includes your dietary management, pharmacological management, and psychotherapy. Dietary management means what all alterations that we make in our diet. Pharmacological therapy is nothing but a symptomatic management. Whenever you have diarrhea, you will give something. Whenever there is a muscle cramps, we will give something like antispasmodics. Whenever there is a constipation, we give laxatives. Likewise, symptomatic management and psychotherapy. Psychotherapy in the form of cognitive behavioral therapy. Likewise, the treatment of this IBS can be classified into dietary management, pharmacological therapy, and psychotherapy. This we have already discussed, and along with this, now lifestyle modification is also important in the management of IBS. Now we will see how each step is contributing to the management of IBS. First is your lifestyle modification. As I already told you, your stress, anxiety, the hectic lifestyle, everything is contributing to your alteration in your gut-brain axis, which in turn leads to IBS. So first thing that should be taken into account is your stress management. First, your stress management, you should practice relaxation techniques and any sort of like yoga, pranayama, any sort of relaxation techniques you should practice. Along with that, in modern science, they suggest cognitive behavioral therapy. It is nothing but elimination of your negative thoughts and enhancing your positive thoughts. Likewise, we will bring about a change in your behavior. That is cognitive behavioral therapy. Next one is that you should go for a regular exercise. In this hectic life schedule, you should have time for maintaining your body also. That is very important. So you should have time for your regular exercise, which should not be avoided. Next, and the most important thing, you should have an adequate sleep. Most of this time, we have an altered sleep pattern. Either it will be sleeping hours are so less because of a hectic schedule. So you should make sure that you have adequate sleep. So these are some of the life modifications that we can put forward to in the management of IBS. One is your stress management. Next is your regular exercise pattern, and the last one and the most important one, that is adequate sleep. Now, what are the dietary changes that we should incorporate in the management of IBS? First thing is that you should have an increased fiber diet. An increased fiber diet will regulate your bowel movements as well as it helps to relieve constipation. So it is very important to include fiber in your diet. And the next one is that you should have a proper hydration. That is, proper amount of fluid should be there in your body for your proper digestion and metabolism. Next, and the next one is the patient himself or herself can identify the triggering factors. That means there will be some factors or some particular food that is actually exacerbating their symptoms. It varies from individual to individual. So it is actually the individual herself or himself should identify those triggering food factors and should avoid those things. That should be done by the patient himself. And The last one, that is a low FODMAP diet. This FODMAP diet is particularly indicated in IBS, just like our Rome's criteria. This particular FODMAP diet is specifically set for in the condition of IBS. So let us see what does this low FODMAP diet means. What are food maps? Food maps means fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. This is the definition of food map, that is fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And these foods should be taken in very low quantity in condition of IBS. This is because these food maps diet will actually increase the water content of our colon. And these sugars are poorly absorbed, as a result of which they become undigested. They will results in fermentation, and there is production of numerous gases which further result in abdominal distension. So this FODMAP diet should be taken very less, reducing the amount of FODMAPs. Now, recent studies again suggest that gluten-free diets are beneficial in the management of IBS. So the dietary management of IBS is as follows. One is that you can increase your fiber content of the food. You can take a low FODMAP diet. You can take gluten-free diets, a proper hydration, and the patient should identify either his or her triggering factors. Now, the conventional medications that are given, as I told you, this is nothing but your symptomatic management, like antispasmodics whenever you have a muscle cramp, antidiarrheals, antiflatulence therapy, laxatives, stool bulking agents, and probiotics. In this set of medicines, now probiotics are emerging as a better or a best treatment in the management of IBS. In Ayurveda also, we can find the use of these probiotics in the management. So the medications or the medical therapy that is commonly practiced include antispasmodics, antidiarrheals, antiflatulence, laxatives, probiotics, and stool bulking agents. Now, the last one, that is your psychological therapy. This is very important as it is the psychological factors are present in the cause as well as the exacerbating factors in IBS. So the psychological therapy, as I told, includes cognitive behavioral therapy and hypnotherapy. So these are the conventional management of IBS. First, you will have a dietary management, you will have medications, you will have psychological therapy, then you will have lifestyle modifications. Now, we have already finished with, we all understood what is IBS, what are its causes, pathogenesis, symptoms, and the conventional management. Now we have to understand the Ayurvedic view on IBS. What does Ayurveda, what Ayurveda tells about IBS? What are its management? Now, in Ayurveda, we have a unique relationship between Koshta and Agni. Koshta is nothing but your GI tract, and Agni is nothing but your internal intestinal fire. So whenever your internal fire or intestinal fire, that is your digestive enzymes, everything, whenever it gets hampered, it will definitely affect the functioning of the koshta or your GIT. So here in Ayurveda, we give very importance to this Agni because we have a special branch called Agni Chikitsa, where initially in Ayurveda, it's in initial treatments of Ayurveda begins with the correction of Agni. Impairment of Agni is considered as the main cause of Grahani Rogas. So in Ayurveda, this condition of IBS may be correlated with a disease called Grahani. And in Grahani, it is already told that the impairment of this Agni or your internal digestive fire is considered as the main culprit. Normal functioning of Agni largely depends upon the external and internal factors linked with the lifestyle of an individual. This we have seen already in the modern also. That is, when your external as well as internal factors are actually affecting your intestinal fire, which in turn affects the proper functioning of your koshta or GI tract. In Ayurveda, cardinal features for Grahani Roga have similarities with those mentioned for IBS. Ayurveda has a holistic approach to its management also. Okay, so in Grahani Roga, it is mentioned that we have to protect our Agni in any way. Somehow we have to protect our Agni. It is told in Grahani Roga Chikitsa. So what all measures that we can adopt to protect Agni is the first treatment in IBS. Then again, we have a unique concept or a unique formulation called Takra Prayoga, which is mentioned in Grahani. Takra is nothing but buttermilk, but in Ayurveda, it is medicated buttermilk. So now we'll discuss in detail about the Ayurvedic management of IBS. Ayurvedic management of IBS is as follows. It includes internal medications, external therapies, Takra Prayoga, Sattvavajaya Chikitsa, Yoga and Pranayama. Now, internal medications. Internal medications includes all those kashayas, gulikas, churnas that we give for internally for the purpose of shamana or pacifying the symptoms of IBS. And some of the commonly used formulations include Kaidaryadi Kashayam, Kalashagadi Kashayam, Mustadi Kashayam, Hriberadi Kashayam, and churnas include Yavanyadi Churnam, Ashta Churnam, then this Shaddarna Churna, etc. Now, external therapy. So, in Ayurveda, we have a concept called tridoshas. That is, our science is based on this tridosha concept. Three doshas are there, Vata, Pitta, and Kapha, and the derangement of these doshas results in Vyadi or the disease. So, in Ayurveda, we say that whenever there's a bahudosha avastha, that is, whenever there is an accumulation of doshas, we have to go for a shodhana therapy or panchakarma therapy. That is, we have to eliminate those doshas through panchakarmas. And the panchakarmas include Vamana, Virechana, Vasti, that is your emetic therapy, purgation therapy, your nasal therapy, all those things. So whenever there's an increase or accumulation of doshas, definitely you have to go for a Shodhana karma or panchakarma. So in this condition, a unique formulation called Pichavasti is indicated, which is widely practiced in Ayurveda for the management of this condition. Then another two unique concepts that Ayurveda has in the management of IBS is that one is the Takra Prayoga and one is the Sattvavajaya Chikitsa. Takra Prayoga, as I've already told, it is Takra, it is not the usual buttermilk that we have. It is the medicated buttermilk that we give. And Sattvavajaya Chikitsa is nothing but your increasing your mental strength. Anything that all those treatments which we give to increase your mental strength. Because we have already seen that stress, anxiety, depression, etc. are contributing to this disease to a higher extent. So it is very important to take care about the mental health of the patient also. So these two unique concepts, one is the Takra Prayoga, another is the Sattvavajaya Chikitsa, is actually very important in the management of IBS. And lastly, we have relaxation techniques like yoga, pranayama, and so on. So the management of IBS in a GIST form is internal medications, external therapy, the unique Takra Prayoga, the Sattvavajaya Chikitsa, yoga, and pranayama. Now, we will go into detail about the role of Sattvavajaya Chikitsa. Sattva is nothing but your mind. So anything that increases your mental strength can be taken as Sattvavajaya Chikitsa. I have already told that the psychological factors are playing a very important role in IBS. And what happens is that due to stress, anxiety, depression, etc., you're actually having a change in your microbiota. That is, there is an increase in harmful bacteria and a decrease in the beneficial bacteria, and which in turn results in a disruption in your gut-brain axis and makes this disease a chronic one. So the basic underlying pathology may be your decreased mental strength. So it is very important to take your mental power or your health of your mind into consideration. And this is a unique contribution of Ayurveda. Now, the next unique contribution, that is the Takra Prayoga and Grahani. Our Acharyas have told that Takra is considered as Amrita, that much auspicious, that much divine in the management of Grahani. Takra is highly valued for its ability to improve digestion and pacify the diseases related to the digestive system. It is very important in the management of all your GI tract disorders. So one thing that you can incorporate is that you can have these medicated takras or buttermilks as a part of your diet. That will definitely help those patients with the, IBS. Takra is said to be lagu, that is, it is easy to digest. Deepana, that is just carminatum. Grahi, it has a holding capacity. And this tridosha shamana, that is, in Ayurveda, we say it's tridosha shamana means it will pacify all the doshas and it will give us health. So Takra is very important. It is considered as Amrita, that much auspicious in the management of IBS. We have certain yogas like Takra Rishta. Since certain churnas are given along with Takra, different vegetables or soups can be taken along with Takra. Based on the patient's strength and season, it can be taken up to a period of 1 week, 10 days, 15 days, or 1 month. This duration is according to the condition of the patient as well as the strength of the patient. So one thing I can say is that you can take this medicated takras or these takra prayogas by our consultation, and you can include this takra as a part of your diet, which will definitely help you. Now, we have already told them about usage of probiotics in the management of IBS, modern management of IBS. Now, researchers suggest the use of takra as a probiotic. Takra itself is acting as a probiotic. Recent studies are saying so. It is a rich source of lactobacillus and bifidobacterium, which is effective in the management of IBS and many other metabolic disorders. That is, takra itself contains, then it is a natural source of our beneficial bacteria, that is lactobacillus and bifidobacterium, which is actually good for our gut. So takra is a rich source of our beneficial bacteria, which in turn helps to decrease the symptoms of IBS. Another importance of takra is that in diseases like Grahani, where food and lifestyle plays a major role in pathogenesis, use of takra helps in controlling the symptoms. Here, as I told, not only your internal medications, not only your not only your dietary changes and lifestyle modifications, all these together actually playing a role in the management of IBS. So these dietary modifications in the form of this medicated takra, which can be included, which will definitely reduce the symptoms of IBS. Takra contains the beneficial bacteria that support the gut health by improving the balance of gut flora. Moreover, it enhances your digestion, boosts your immunity, and reduces the gastrointestinal issues. Takra is also having a unique property to reduce your inflammation. While discussing the pathogenesis of this IBS, we have seen that what happens. There is a mild inflammation of the gut. So, this takra is able to reduce that inflammation. So, in that aspect also, it is benefiting the patients. Takra has antioxidant properties that help to neutralize the harmful free radicals in the body, contributing to overall health and reducing the risk of chronic diseases. That is yet another important property of takra. It has antioxidizing properties which will help in the elimination of these free radicals which play a vital role in the manifestation of metabolic disorders. 1 cup of buttermilk contains approximately 98 calories with proteins, carbohydrates, sodium, potassium, calcium, and traces of phosphorus. So in some way, it is also supplying your microelements, which is very much important to you. So this takka prayoga is very, very important for the management of IBS. Now, use of probiotics. Lactobacillus is the most common probiotic used to improve the intestinal barrier. Dairy products are vehicles by which consumers receive adequate quantities of probiotic lactobacilli. So we have already seen that this takra already contains this lactobacilli and bifidobacterium, that is our beneficial bacteria, in ample amount, so that it itself is now acting as a probiotic. Fermented dairy products like yogurt are products of high value, now known as functional foods, are widely consumed because of their positive health impact. Now, these probiotics, we take these probiotics in the form of fermented dairy products like yogurt, curd, etc., curd, buttermilk, etc. Now, these are having a very positive impact on our health and in reduction of symptoms of IBS. So takra prayoga, which is a unique concept of Ayurveda, is actually contributing very much into the management of IBS. It is a good source of your beneficial bacteria, that is lactobacilli and bifidobacterium. Moreover, it has antioxidant properties which helps in the elimination of free radicals. It also supplies your microelements like sodium, potassium, calcium, phosphorus. Moreover, it also helps to reduce your inflammation, gut inflammation, which is also a part of the pathogenesis. So we can come to a conclusion that in the management of IBS, we should incorporate these factors. One is your internal medications. Next is your external therapy. Next is the unique contribution of Ayurveda, that is your takra prayoga. We have already seen the importance of takra in the management of IBS. Next is the Sattva-Vijaya Chikitsa, which is yet another unique concept. That is your mental health also should be properly maintained. And lastly, the relaxation techniques like yoga and pranayama. So I hope with this we are coming to a conclusion. I hope now you understood about the disease IBS, its relevance, how it affects our quality of life, the causes, symptoms, pathology, the conventional management, as well as the Ayurvedic management. Thank you for your patient listening. We will meet in the next week with a different topic in a different seminar. Thank you.